Thank you for the testimonial, Mr. Roche, here at Chicago Arthritis. If I may ask you a few questions in regards to the testimonial we will be putting up. If I may please get your full name.
My full name is Peter Thomas Roche.
Okay, and then your age, please.
My age is 73 years old.
Okay, so I'm going to start off by asking you just three brief questions, if you could be so kind to answer those for me. What was your life like before your procedure? What were you unable to do or perform that made you upset?
My knee, I hurt my knee back about 6 months ago. And I was told that it was ultimately through an MRI, a meniscus tear. And as I endured the pain, it never got better. I went through some therapy, but it never really worked. And it kept getting worse to the point where, you couldn't go up or down steps. And you couldn't exercise. And I exercise a lot, but I pretty much had to drop out of everything because I couldn't do it. So I became to a point where I looked at surgery, and then ultimately looked at stem cell.
Great. And then if I may ask you, what was your experience like for the procedure from the beginning and end of the procedure?
The procedure was in 3 steps. The first step was where they prepared the knee. The second step was where they did the stem cell and platelets. And then the final step is they did platelets around the ligaments of the knee. The procedure was done over 3 days. I did it about 2-3 days apart. So I was pretty much done within 2 weeks. The process was very thorough. The Dr. Tambar was very gentle as he did the process, and it was not at all as invasive as I thought it was going to be.
Thank you for that information, because a lot of patients do ask, is it going to be very painful? Is it going to be, something that I can't do any movement or my, routine and whatnot? So thank you for that information.
Well, it was, I'm a big chicken anyway, so I was expecting the worst, and then basically found out that it was much better than what I thought.
Yes, thank you for that information. Mr. Roche, and the very last question, if I may ask, please. What would you tell someone to consider Chicago Arthritis for our procedures that we perform here?
Well, I think a couple things. I think the initial discussion with Dr. Tambar, he was very thorough on what was going to happen, what I could expect, and he was very kind and gentle as we went through that. And he did not come across as a know-it-all kind of doctor, but concerned about the patient, concerned about what you thought, and then he tried to address those concerns or needs that you had. I think as we went through the process, I found out from him, each step of the way what would happen. And which was really quite interesting because, I was expecting something a little different, but he outlined exactly what he was going to do, how it would work, and then afterwards, if you had any kind of pain, what it would be. And basically, he said the pain levels would always be within the 1 or 2 range versus the 7 to 10 range.
Right.
So it's something that when you think about it, it's something you can live with versus if you went through surgery, the pain levels will be quite different.
Right.
And I think the other thing is the recovery time with the stem cell. You go through physical therapy, but the recovery time before you start feeling better is very short. It's within 4 to 6 weeks, you know it's beginning to work and you can feel the difference. You know, whereas like today, I can go up and down steps, I can do my swimming, I can walk around the grocery store with no pain, I can get in and out of a car without pain.
That's great.
And so these are all things that, you know, you take for granted. And when you don't have good knees or a good back or whatever you have, you realize that it's really a gift to have good health.
Right.
So I think, and what I like about Dr. Tambar, that's his mission. I know he gets paid for what he does, but his mission is to get you healthy again so you can have a good, productive life. And that, as far as a doctor's concerned, that's my primary concern, that the doctors invested in my health, and which has worked out very well here at Chicago Arthritis. And one final point, I think the staff here is very caring, very concerned. They do a good job and they want to make sure that you're okay, and that you're not feeling bad, or that if you have a concern, it's addressed. So overall, it's a win-win.
Thank you so much, Mr. Roche.